Good morning friends. Today we are going to see about knee joint. Knee joint in particular with sports related injuries. So knee joint, as we all know, it's a synovial joint, it's a load bearing joint. See, load bearing, why I am saying is that it is in the lower limb, it is next to the hip joint. So the weight from the upper part of the body transfers to the lower one through this knee joint. So knee joint has upper femur, the lower tibia and the fibula, these three bones, and you have one cartilaginous bone, that is your patella. The small bone which is there in front of the knee is called as patella. Okay. So what I am carrying is the right sided knee joint. You imagine that this is your right sided knee joint, and even in this picture you can see the small bone here, that is the fibula, and which is present in the outer surface. Okay, here in my right side it is in the outer surface. So the inner surface, the outer side, and here also the outer side, and here also it is in the outer side. So this is the lateral surface and this is the medial surface of the knee. Okay, so just go on imagining what is happening in a knee as I tell you. So knee joint has one major function, is this one, flexion and extension. The knee joint bends like this and it comes up like this, and while you are walking, jogging, or you do whatever activities, climbing up, climbing down, this happens inside the knee joint. So to do this function like this, the knee joint needs some accessory movements. What are they? So compression, distraction, rolling, spinning, gliding, anterior glide and posterior glide. All these things happen inside the joint without your knowledge. Actually, you cannot imagine, or you can only imagine, but you cannot feel that what is happening inside. But all these movements happens inside to bring one large movement, main movement. This is flexion and this extension. Okay, so why I am saying about the accessory joint is, as you cannot feel it, you cannot feel the injuries which is happening in a very small way inside your knee joint. So when these accessory joints fail and when they get summated, these small injuries will lead to a outcome with a bigger clinical sign, that is pain and stiffness. Only at that time you will be coming to know, okay, I am having a pain in the knee. So you should have a knowledge on accessory movements and where the pain comes, whether the pain comes anteriorly, that is in front part of the knee, or it comes laterally, or it comes medially, the inside part of the knee. Mostly the pain comes in the inner side of the knee and it comes in the anterior side of the knee. Why? Because the inner side, the knee carries maximum weight. The weight transference in the inner side is more, significantly more. How much? Nearly 80%. It is on the inner side of the knee rather than the outer surface of the knee. And the inner side, the platform, we say, the platform is larger than the outer side. Okay, so where the pain occurs, how it slowly builds up, everything you should be keen and you should observe, and you should put proper immediate response towards that pain. That's why I am explaining you this. Okay, now we will see about this is the meniscus. Actually, this blue color is the meniscus, and that is a cartilage. These form the cushion of the knee. Actually, because it weight transfers, you need a cushion, and this cushion always regenerates. This cushion will always regenerate as faster as possible, and so that it maintains the knee's health. Now, as a sportsman, even for a common man, but sports people I say, because they use this knee to the highest to its highest torque or momentum, whatever it is. Okay, so when you run, you have to observe what is happening inside the knee, where the weight transfers, how it ends, where your pain comes, how you are getting trained. All these things are very important. Now there are some criterias which makes your knee fine, and even if you get an injury, it helps in proper and faster healing. Those criterias are, one is hydration. You hydrate your body properly, because the maximum amount of material which is there present in the body is water. Okay, so hydrate it properly. If you don't have adequate water inside the body, Instead of maintaining elasticity, all the structure will become more plasticky. So elastic, the property goes off and becomes plastic. When it becomes plastic, whenever you demand a function from that structure, it may fail, and that failure can be a simple trauma or a small micro injury or a complete tear of any of the ligaments inside. So you have to hydrate the knee properly so that it functions properly. Even to maintain this cartilage inside the knee, you need proper hydration, because this cartilage functions on a common physics in a term called hydrophilic and hydrophobic repulsion. Okay, we don't have an oily structure in this area. It purely functions on hydrophilic and hydrophobic ends, all of made up of water molecules. Okay, so now what you see here is this tendon. What you see here, the large tendon, is your quadriceps. The big bulk of muscle which is there in front of the knee is the quadriceps, and this quadriceps travels like this and it ends in the tibial tubercle. Actually, this is the lower bone. It crosses like this and it ends here. Okay, now why I talk more about quadriceps is this is the more prone area for injuries. Okay, so see, when you flex, when you bend and when you extend, more particularly this 15 to 20 degrees or 30 degrees is the area where you walk, and more than 30 to 40 degrees is the area where you jog, and sometimes more than 40 to 50 degrees is the area where you fast run. So these are the joint range of movements and its related movement analysis. Okay, so when you do this patella rubs like this. Okay, it rubs and it sinks into this hole. Okay, it sinks into this hole. You can see the patella moving. So there is huge amount of torsion and huge amount of compression forces going on in this anterior knee. And if there is a pain in the anterior part of the knee, it shows that you are having some problem with the quadriceps muscle, or you are having some problem with your training aspects. So you have to put your attention on that and get it corrected as early as possible. That is your anterior knee. One simple reason I will tell you, most of the sports people, what they do is they wear a brace without proper warrant or without proper consultation. They wear a brace. Okay, what braces do is, actually a brace should give a 3-point pressure. It should be based on a 3-point pressure system, and it should hold your knee in a completely safe position. So what is safe position? It should not allow much of movements. Simple. Okay, and you wear a brace and you go for running. What it denotes? You are not allowing the knee to move its own in its own independent territory. So it will damage particularly this patella, because it puts pressure over the patella and it makes this patella rub more over the knee joint, where inferior surface of the patella, that is the inside surface of this patella, gets rubbed inside and you get anterior knee pain. Okay. And one more thing, very simple thing is, most of the sports people I see is they wear tights, and that tights sometimes it is still here or it is a full tight which is extending till the full of tibia or 2/3 of tibia. What happens is that tights puts a pressure over the knee. Every time you train, every time you enter into sports, that also causes the problem. See, so what I come to tell is, you divide your sports training part and don't allow the knee to move in its own independent movements. Don't restrict them. Okay, so water is more important. Allowing the knee to work on its own independent joint range of movements is more important. And the other one is nutrition. If you are not providing proper nutrition to this bone, if you are not providing proper nutrition to this ligaments, then they fail. Actually, this bone has a system called trabecular system. I am turning the knee now like this. It is having to show you, it is having a system called trabecular system. Trabecular is like what you see in buildings, the pillars, the structures, like that. Bone has its own pillars and beams inside. Okay, what they do actually is, they transfer weight, they bring it down, they spread the weight, they converge it and they pass it to the next bone. And this trabecular system needs a good amount of nutrition to maintain their structural integrity. Okay, if you are not providing good nourishment, this trabecular system fails, and when it fails slowly, where you will notice this only in later stages of the failure, where the bone bends inside or outside, or there can be a micro trauma inside the bone or outside the bone. That also causes enormous pain. And one more thing people misjudge with that is, I'll tell you an example, clinical example is tibial pain. That can be also a cause of trabecular system failure. Mainly they call that as shin splint syndrome. Okay, so when you say about shin splint syndrome, it's a vast area which is where you have to care about cellular level physiology which is happening inside the bone, not only the joints, not only the shoes. Because nowadays you go to the most of the gait lab, whenever you get a shin splint syndrome, you go to the gait lab and assess it, and they'll give you a shoe, and we think that that shoe will change everything, or the advice they give you changes everything. It is not. You have to take care of your knee, you have to take care of your ankle joint, the ankle mortise, which we'll see later. All these things are very important when you get a pain, and particularly for people who are demanding more out of the knee and ankle. Okay, so that is about the nourishment. And the other thing what we should consider is strength training and flexibility training. Strength training, as we all know, you have to strengthen the muscles of the knee, and you have to strengthen the core muscles which is around the knee. And flexibility training, you need, as I always give importance, the muscles length tension ratio you have to maintain. If you go on stretching your quadriceps and if you are forgetting your hamstrings, again it's a problem. If you are stretching your adductors and if you are not stretching your abductors, the lateral side of the thigh, again that is a problem, because they act as a guy rope around the knee, and they should be in its proper length tension relationship. You take care of one muscle, you strengthen one bulk properly, and you leave the other muscle, they don't synchronously work. That also affects the knee. So whenever you get a knee joint, don't just enter into strengthening exercise, or don't just enter into a stretching exercise. Think about what is happening around the joint. Okay, so and the other important thing what we should know about the knee is your running style. Okay, mostly when we walk, sometimes we injure the knee, and when we run, when we train, we injure the knee. Again, I'll give you an example of that is mostly when people run, you can hear a jerk sound. When they jog, you can hear a jerk sound. They'll scratch the leg on the floor. It can be a toe landing, it can be a midfoot landing, it can be a heel landing, whatever landing it is, you can hear a sound. Okay, so what happens is, what is that sound actually is, during that sound you are fixing the tibia, and the whole body propels on the fixed tibia. So that is a torsion happens here. For every step you create a torsion here, and that will produce the anterior knee pain, and sometimes it produces an arthritic changes, inflammation of the joints where it goes. And the same related example, one more example is when people do interval training, they run in their fastest pace, maybe like you keep it as 4 or 4.5, and they stop somewhere immediately as the watch ticks. That is wrong. Why? Because you run in a faster pace and you are stopping immediately. That demands a lot of stress on the knee, because you break where the tibia stops, and this takes its momentum. It grinds. Okay, the entire body weight grinds this with the femur over the tibia. That causes a problem. So what is the answer for that? Whenever you do a training and you want to stop gradually. Don't put more importance to the watch tick. Give importance for how you stop smoothly. Okay, stop smoothly, then go ahead. Don't put a jerk on the knee. These are the things which we should consider about the knee. And whenever you get a knee pain, take a rest and assess what is happening. I'll give you an example of how to assess yourself, whether it is the pain from ligament or pain from muscle or pain from the joint. See, today you run and you take a rest. If the pain, all pains and things related stuffs goes off, then good, you are healing it properly, you are well hydrated. No, if it is happening otherwise, you are getting into the morning run and you feel that the pain is there still when you are warming up and you are starting your jogging. As you jog, if the pain goes off, that pain is mostly muscular. As you jog, if the irritability level is less and the pain goes off, that is muscular, because in warm up muscle pain uh, disappears more faster. Okay, so that is muscular. And you are running, one pain is gone, but still one pain is remaining. That should be from your joint pain. Okay, why? Because joint pain takes a lot of time and it needs a larger warm up, then it disappears. So what I am coming to say is, they are not healing, they just disappear. So you run, your pain is going. What we think is, no, if I run, all the pain goes and I am fine. It is not like that. They are just disappearing and they will come back. So allow proper time to heal, and you make your diagnosis. Okay, this is my muscle and this is my cartilage or bone which is getting affected, and you answer yourself because of what you have done and how it has created. You make an assessment, and still if it is not, if you are unable to clear it on your own, after hydrating you properly, after taking proper rest, after doing proper strengthening exercise, after doing proper flexibility exercise, after doing proper warm up and cool down. Warm up and cool down is very important. There are lots of individual styles which is going on warm up and cool down. We will see a separate session on warm up and cool down of for the lower limbs. Okay, so that is also very important. If all these things are good and still if you have a knee, you have to attend or take care of it professionally. And this is all to say simple about the knee. You just see this, remind yourself about the structure, and remind yourself about the causes, and remind yourself about the um, diagnosis, self diagnosis. As I said, as you warm up, what goes first, then your knee will function properly, and you can take the maximum advantage of your knee during sports. Thank you so much, friends. Stay in touch.